Well, we've talked a lot about the frustrations over health care insurance coverage, from the treatment denials to soaring out-of-pocket costs, and now many people are opting for cash discounts.
Yeah, with health insurance premiums on track to skyrocket next year, the option is gaining popularity. Some hospitals and clinics that cost hundreds of dollars less if you pay cash instead of using insurance. But experts have a warning about making those bargains when it comes to medical care.
Yeah, NBC News health and medical reporter Berkeley Lovelace Jr. joins us with more. Berkeley, this is interesting because on one hand, a lot of people say that it's cheaper to pay cash for certain medical services like x-rays, blood work. But then on the other hand, health insurance does offer crucial protections. Which protections? Walk us through the pros and the cons here.
Yeah, so in some cases, very simple things like an x-ray or a blood test can actually be cheaper with cash. And so many hospitals actually provide discounts if you pay up in front with cash. And so you see this all the time actually in the prescription drug world too. So sometimes it's actually cheaper to pay for a generic drug out of pocket than using your insurance. But there are some pretty big trade-offs here. So if you use cash, that money is not going towards your deductible or out-of-pocket limits. Also, if you get sick or have multiple healthcare visits than you expect, then you could end up winding up paying a lot more for your medical bill than you would with insurance as well. And so insurance, for all its frustrations, does have some protections. So you have caps on costs, you have your insurer's negotiated, and then also you get free preventive care, so things like cancer screenings or routine vaccinations, annual physicals, a lot of things that you wouldn't have to pay for with cash.
Interesting.
Yeah, that's good food for thought, Berkeley. You also talked with healthcare professionals who say people need to be really careful if they're using cash discount options. So what do people need to know?
Yeah, so the main thing is just to don't assume that the cash price is always cheaper. So your insurer does have a negotiated rate. In some cases, it might actually be lower. It's also important to note to ask a lot of questions when you're asking about paying in cash. So when do you have to pay? Does that cost include hospital stays or the labs needed? Will you need follow-up care? Do you have access to a payment plan? And it's also important to note for people who are uninsured also, they can also access federally qualified health centers. And so they often provide low cost or free care for patients who are uninsured as well. So you also have that option as well.
One thing that caught us both by surprise, I think, this morning that was so interesting is that a lot of people are also opting into health shares. What are those?
Yeah, so these are where members basically pull their money together. They're each putting money down each month in order to help pay for their other people's medical bills. The premiums are also very cheap. But also, it's important to note there is that they often don't follow the same state and federal rules as traditional insurance. So there are some risks there as well.
Yeah, it's a little off the grid, but people are doing what they can because health insurance is expensive. All right.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.